Have you ever heard of a heart condition that can sneak up on you? It's like a ninja hiding in the shadows. This sneaky villain is called ARVC, short for arrhythmogenic right ventricular cardiomyopathy. Big words, right? But don't worry, we'll break it down. ARVC is a heart disease that mostly affects young people. It weakens the walls of your heart, making it hard for your heart to pump blood properly. Imagine your heart is like a house. ARVC is like termites, slowly weakening the walls from the inside out. What makes ARVC even scarier is that it can be silent. Some people don't even know they have it until it's too late. That's why it's super important to learn about ARVC and catch it early. So, how do doctors find this sneaky heart ninja? They use a bunch of cool tools and tests. One of them is called an electrocardiogram, or EKG for short. It's like a heart monitor that shows how your heart is beating. Another test is called an echocardiogram. This one uses sound waves to create pictures of your heart, like a sonogram for your baby brother or sister. Doctors can see if your heart muscle is weak or if there are any problems with the way it's pumping. Sometimes doctors might also use special imaging tests like an MRI or a CT scan to get a closer look at your heart. These tests help doctors rule out other heart problems and make sure it's really ARVC. Even though ARVC can be sneaky, it often leaves clues. One of the biggest warning signs is feeling dizzy or lightheaded, especially during exercise. It's like your brain is saying, "Hey, I'm not getting enough blood here." Another red flag is fainting. If you're passing out for no reason, it's time to see a doctor. Stat. Some people with ARVC also feel their heart racing or fluttering in their chest. That's called palpitations, and it can be pretty scary. Remember, these symptoms can be caused by other things too. So, it's important not to jump to conclusions. But if you're experiencing any of these, don't ignore them. Tell a grown-up and get checked out by a doctor. Section 4. ARVC by the numbers. Who is at risk? ARVC is a rare disease, which means not a lot of people get it. But it's still important to know who's at risk. ARVC can happen to anyone, but it's more common in young adults and athletes. Why athletes? Because ARVC weakens the heart muscle, and athletes push their hearts to the limit. This can make the symptoms of ARVC show up earlier. It's like trying to run a marathon with a flat tire. The good news is that doctors are getting better at diagnosing and treating ARVC. With early detection and the right treatment, people with ARVC can still live long and healthy lives. Section 5. The early bird catches the worm. Awareness is key. Remember, knowledge is power. The more you know about ARVC, the better prepared you'll be to protect yourself and your loved ones. Talk to your family and friends about ARVC. If you have a family history of heart problems, tell your doctor. They might recommend getting checked out for ARVC, just in case. Early detection is key. The sooner you catch ARVC, the better the chances of successful treatment. So stay heart healthy, my friends. Listen to your body, be aware of the signs, and don't be afraid to ask questions. Together, we can beat this sneaky heart ninja. Like, share, comment, and subscribe